And the Ministry of Health and health unions have condemned the attack on a healthcare provider at Port Victoria Sub-County Hospital in Busia, while terming the assault as reprehensible and intolerable. The Health CS has assured the country that the perpetrators will be arrested and arraigned in court to face the full force of the law. And as Mary Muoki reports, the attack captured on camera has elicited strong reactions from doctors and other health workers who have condemned the attack and called for immediate action.
It started with this clip recorded on Tuesday, January 2nd at Port Victoria Sub-County Hospital in Budalangi in Busia County. In the video, the two are heard harassing nurses at the facility and hurling insults at the healthcare workers. The lady, who has since been identified as Vanessa Ogem, a theatre technology student at the Nairobi Women's Hospital College, is seen scattering objects lying on the nurse's table while the nurses cower in the corner. Sources say the two had accompanied their relative to the facility for treatment and got impatient with the long queue before resorting to threats and intimidation on the nurses, demanding to have their patient attended to fast. When their threats failed, the lady is heard threatening to call a senior government official who has since distanced himself from her and her antics. While on a tour of the region, Health CS Susan Nakhumicha has condemned the incident and promised swift action against the two.
So you come as a patient, instead of being a patient waiting patiently to be served, you are there, you want to make noise at health workers. Health workers are the pillar of healthcare in this country. As a Minister for Health, I will not allow it for anybody to disrespect my health workers. These people are working under very difficult circumstances.
The incident continues to draw ire from Kenyans, with many questioning how the woman, a trained healthcare provider herself, turned around and meted abuse on a fellow healthcare provider. Nakhumicha lauded the nurses for maintaining civility and professionalism under the circumstances, while vowing to ensure justice is served.
But I'm calling upon my colleague in Interior that we must identify that person and let them face the full force of the law. Because as they did that, this nurse ought to have been serving other patients. But now they hampered the nurse from serving. So we are not going to allow it to happen. I'm going to be the advocate of health workers. They must be respected. They must be protected.
A joint statement by the Health Union Caucus has strongly condemned the incident, terming it as an act of aggression that jeopardizes the safety of healthcare workers and also undermines the delivery of healthcare. While calling for the arrest and prosecution of the aggressors, the union has also demanded for enhanced security surveillance and intervention protocols in all health facilities across the country, the provision of armed security personnel in all health facilities, especially during night duties, and the urgent implementation of Occupational Safety and Health Act within health facilities. A study released by researchers from the Aga Khan University found that nearly half of healthcare workers in Kenya reported experiencing violence, with the most common form of violence being verbal and emotional abuse. The study, titled Violence Against Healthcare Workers, spoke to a cross-section of healthcare providers in Kenya and found that 49.9% reported experiencing violence, with verbal violence at 80.6% and emotional violence at 78.6%. Patients and or their relatives were the most common aggressors, with 44.7%, while supervisors accounted for 12.5%. Mary Muoki, Citizen TV.